Every 3 seconds, someone, somewhere in the world, develops dementia. For many families, it begins so quietly that nobody notices. A father who suddenly forgets where he parked. A grandmother who repeats the same story 3 times during dinner. A retired teacher who can no longer remember the password she's used for 10 years. Everyone says the same thing. Well, that's just aging. But what if it isn't? What if the problem isn't growing older, but something sitting inside a small orange prescription bottle on the kitchen counter? Today, we're talking about medications that millions of people take every single day. Many are prescribed with good intentions. Many improve quality of life. Many are absolutely necessary. But research over the last decade has uncovered something every older adult should know. Certain medications may increase confusion, brain fog, memory problems, and in some people, contribute to cognitive decline when used long-term. This video is not about stopping medications. It's about becoming an informed patient. Because one conversation with your doctor could protect both your health and your memory. Stay until the end, because medication number 3 surprises almost everyone, and millions of adults take it every single night without realizing what it may be doing to their brain. Before we begin, tell me in the comments, how old are you, and how many prescription medications do you take every day? Let's start. Understanding your brain. Imagine your brain as a city. Billions of nerve cells communicate every second. Tiny chemical messengers travel between them carrying information. One message says, "Remember this face." Another says, "Store this conversation." Another helps you learn something new. Now imagine someone slowly disconnecting those communication lines. Not all at once, little by little, day after day. Eventually, messages arrive late. Some never arrive at all. That's when people begin saying, "I know the word, I just can't remember it." Or, "I walked into the room and forgot why." Some memory changes are normal, but medication-related brain fog often develops gradually and quietly. Let's look at the first one. Medication number 9, sleep aids containing diphenhydramine. Millions of people use them, especially after age 65. They promise better sleep, less itching, or allergy relief. Many are available without a prescription. That's exactly why people assume they're harmless. But these medications belong to a group called anticholinergics. Why that matters? Your brain depends on a chemical messenger called acetylcholine. It plays an important role in attention, learning, and memory formation. Certain sleep medications temporarily block that messenger. You become sleepy, but your brain also becomes less efficient at processing new information. Occasional use may not cause noticeable problems. Long-term nightly use is a different story. George was 73. Every evening he took the same pink sleep pill. For years. Eventually he started forgetting appointments. His daughter worried about dementia. During a medication review, his physician identified the sleep aid. Several months after changing to a different sleep strategy, George reported feeling mentally sharper than he had in years. The medication wasn't the only factor, but it was certainly part of the picture. Better sleep without brain fog. Consistent bedtime. Morning sunlight. Limiting caffeine late in the day. Regular exercise. Relaxation routines. These simple habits often improve sleep without increasing medication burden. Medication number 8. Long-term acid reflux medications. Heartburn can be miserable, so medications that reduce stomach acid have helped millions of people. But there's something many people never hear. Your stomach acid has important jobs. It helps absorb nutrients like vitamin B12, iron, magnesium, and calcium. Why B12 matters. Vitamin B12 supports healthy nerves and healthy brain function. When levels become too low, people may experience fatigue, tingling, difficulty concentrating, memory problems, and confusion. Sometimes these symptoms are mistaken for early dementia. Story: Susan was 69. She complained about forgetfulness and low energy. Her family worried about Alzheimer's disease. Blood work showed severe vitamin B12 deficiency. She had taken acid-reducing medication continuously for years. After treatment and medical supervision, her energy and concentration improved significantly. Not every case is that straightforward, but sometimes the brain simply needs the nutrients it has been missing. Doctor's advice: never stop reflux medication without medical guidance. But if you've been taking it for years, ask your physician whether reassessment, dose reduction, or periodic nutrient testing is appropriate. Medication number 7. Bladder control medications. This topic affects millions of older adults. Overactive bladder can interrupt sleep, limit travel, and create constant anxiety. Medication often provides real relief. Unfortunately, some older bladder medications also block acetylcholine, the same brain messenger we discussed earlier. What patients notice: I lose my train of thought. I forget names. I walk into rooms and forget why. I can't concentrate like I used to. Many people assume these changes are simply part of aging. Sometimes they're not. The hidden problem. Older adults often take a sleep aid, a bladder medication, and an allergy pill simultaneously. Each medication may have only a small effect. Together, those effects add up. Doctors call this cumulative medication burden. And that's where memory problems often become much more noticeable. Your brain loves simplicity. One of the healthiest things older adults can do is periodically review every medication they take. Prescription medications, over-the-counter products, supplements, herbal remedies. Many people are surprised to discover duplicate ingredients or medications they no longer need. The power of a medication review. Bring every bottle to your doctor's appointment. Everything. Even vitamins. Even herbal products. Even occasional sleep aids. Ask one simple question: do I still need every one of these? That conversation alone has improved quality of life for countless patients. Brain-healthy habits that matter more than pills. Many people search for memory supplements, but research consistently points towards something much simpler: walking, strength training, good sleep, learning new skills, reading, social connection, nutritious food, managing blood pressure, staying physically active. These habits support brain health every single day. Take a moment and think about this. How many medications in your home were originally intended for short-term use, but quietly became part of your daily routine? Many people discover they've been taking the same medication for 5, 10, or even 15 years without ever reviewing whether it's still necessary. Before we continue, I want to make one thing absolutely clear. Every medication we're discussing today has helped millions of people. Many have saved lives. Many are essential. The goal of this video is not to create fear. It's to help you recognize when a conversation with your doctor might be necessary. Because protecting your memory is just as important as protecting your heart, your sleep, or your blood pressure. Let's continue with medication number 6. Medication number 6. Anti-anxiety medications. Life changes after retirement. People lose spouses. Friends move away. Health concerns increase. It's completely understandable that anxiety becomes more common. That's why medications like Xanax, Ativan, and Valium are prescribed so frequently. For many people, they work almost immediately. The racing thoughts slow down. Sleep comes easier. Stress fades away. But here's the concern. Your brain learns through activity. Imagine your brain is a busy highway. Thoughts, memories, learning, and concentration are constantly moving. Anti-anxiety medications slow that traffic. Sometimes that's exactly what's needed. But when they're used continuously for months or years, the brain can become dependent on that slower pace. Many older adults begin noticing, I feel disconnected. I can't focus. My thinking feels slower. My memory isn't what it used to be. Story. Richard was 74. He started taking an anxiety medication after losing his wife. At first, it helped him sleep. But over the next 2 years, his family noticed something different. He stopped reading books, forgot appointments, lost interest in conversations. Working with his physician, he slowly reduced the medication while starting counselling and daily exercise. Months later, his confidence and mental sharpness improved dramatically. Medication number 5. Certain older antidepressants. Depression deserves treatment. No one should suffer in silence. But not every antidepressant affects the brain the same way. Some older medications also interfere with acetylcholine, the chemical messenger responsible for memory and learning. Why older adults are different. At age 30, the brain often compensates. At age 75, it may not. That's why medications tolerated well earlier in life can produce very different effects later. Many doctors now consider age when selecting antidepressants, favouring options with less impact on cognition whenever appropriate. Doctor's tip. If you've been taking the same antidepressant for 10 or 15 years, don't assume it's automatically still the best choice. Medicine evolves. Newer options may provide similar benefits with fewer cognitive side effects. Medication number 4. Strong pain medications. Chronic pain changes lives. People stop walking, stop exercising, stop sleeping. Pain deserves treatment. But powerful opioid medications can affect more than pain signals. They also influence alertness, attention, and memory. The brain needs stimulation. Think about what happens after surgery. Many older adults become temporarily confused while taking strong pain medication. Most recover, but long-term use may create ongoing brain fog, especially when combined with sleep medications or anxiety medications. Story. Nancy had severe back pain. She gradually stopped driving because she felt foggy. Her physician reviewed her medications and adjusted her pain management plan. Physical therapy, gentle exercise, and different medication strategies reduced her opioid use. 6 months later, she was reading novels again and driving confidently. Pain improved, memory improved, and most importantly, her independence returned. Medication number 3. Cholesterol medications, a balanced conversation. This topic deserves careful discussion. Statins have saved countless lives by reducing heart attack and stroke risk. For many people, they remain the right choice. But occasionally, patients report memory concerns after starting treatment. The important message: never stop cholesterol medication on your own. Heart disease remains one of the leading causes of death worldwide. Instead, pay attention to changes. If brain fog, forgetfulness, or concentration problems appear after beginning a new medication, tell your doctor. Sometimes, a different medication, different dose, or different treatment plan solves the problem. Your brain is connected to your entire body. Many people separate brain health from physical health. They're actually deeply connected. Healthy blood pressure protects memory. Healthy blood sugar protects memory. Exercise protects memory. Good sleep protects memory. Nutrition protects memory. Your brain benefits from every healthy choice you make. Medication number 2. Multiple sleep medications together. Here's something I see surprisingly often. One medication wasn't enough, so another was added. Then another. Perhaps a prescription sleep aid, an allergy pill, melatonin, and an anxiety medication. Individually, each seems harmless. Together, they create excessive sedation. What families notice? He sleeps all morning. He seems confused. He repeats himself. He doesn't seem interested anymore. Sometimes families fear dementia. Sometimes the first step is simply reviewing medications. Reducing unnecessary sedating medications often brings remarkable improvement. The medication snowball. One medication causes dry mouth. Another treats dry mouth. One causes constipation. Another treats constipation. One causes dizziness. Another attempts to fix dizziness. Before long, someone takes 10 medications, when 6 months earlier they needed only 3. This is why regular medication reviews are so valuable. Questions every patient should ask. Whenever you're prescribed something new, ask, how long should I take this? What are common side effects? Could this affect memory or concentration? Is there a non-medication alternative? When should we review whether I still need it? Simple questions, powerful answers. Brain-protecting habits that cost nothing. Scientists continue finding the same patterns among people who maintain strong cognition into their 80s and 90s. They keep moving. They stay socially connected. They challenge their minds. They eat balanced meals. They sleep consistently. They manage chronic conditions. And they periodically review their medications. No miracle supplement has ever replaced those foundations. Story 2. Friends retired the same year. Both developed high blood pressure. Both took medication. One assumed prescriptions never needed review. The other scheduled an annual medication discussion with her physician and pharmacist. Over time, unnecessary medications were removed, doses adjusted, and side effects minimized. The difference wasn't luck, it was communication. Open your medicine cabinet tonight. Look carefully. How many bottles have been sitting there for years? How many began as temporary treatments but quietly became permanent habits? Sometimes the healthiest decision isn't adding another pill. It's asking whether one can safely be reduced or replaced under medical supervision. You've probably realized something important. Memory loss doesn't always begin with disease. Sometimes, it begins with small decisions repeated every day. One extra pill. One medication added but never reviewed. One prescription that was meant for a few weeks, but quietly stayed for 10 years. Today we're talking about the biggest hidden danger of all. Not one medication, but the combination of many. And by the end of this video, I'll give you a simple 5-minute brain protection checklist that every adult over 60 should follow. Let's begin. Medication number 1. The hidden danger of taking too many medications. Doctors have a name for it: polypharmacy. It simply means taking multiple medications at the same time. Millions of adults over 65 take 5, 7, 10, or even 15 medications every single day. Each one may have been prescribed for a good reason: blood pressure, sleep, bladder control, heartburn, allergies, pain, anxiety, depression. Individually, they may be appropriate, but together, they create a completely different picture. Imagine this. Picture your brain as an orchestra. Every musician knows exactly when to play. The violin begins, the piano follows, the drums stay perfectly on rhythm. That's a healthy brain. Now imagine one musician suddenly slows down. The music changes slightly. Add another, then another. Eventually, the orchestra is still playing, but nothing sounds right. That's exactly what happens when multiple medications affect the same brain chemicals. Memory slows, thinking slows, reaction time slows, learning slows. A story. James was 78. He wasn't diagnosed with dementia, but his wife noticed something strange. He forgot birthdays, repeated questions, couldn't remember television shows they watched together. His family feared Alzheimer's disease. His physician ordered a complete medication review. James was taking an allergy medication, a sleep aid, a bladder medication, an anxiety medication, and a pain medication. Each caused mild drowsiness. Together, they created severe cognitive impairment. Over several months, his healthcare team simplified his medication plan. Something remarkable happened. His conversations became sharper. His personality returned. He started reading newspapers again. He remembered appointments. He laughed more. Not because dementia disappeared, but because medication burden had been reduced. Warning signs. Medication may be affecting your brain. Many people assume memory problems always mean dementia. Sometimes they don't. Pay attention if memory changes begin shortly after starting a new medication or increasing a dose. Warning sign number 1. You suddenly forget familiar names. People you've known for years, neighbours, grandchildren, co-workers. It feels like the information is there, but you can't reach it. Warning sign number 2. You become unusually sleepy during the day. You wake up tired. Need frequent naps. Feel mentally slow. Excessive daytime sleepiness deserves attention. Warning sign number 3. You lose confidence. You stop driving. Stop reading. Stop participating in conversations. Not because you don't want to, but because thinking feels harder than before. Warning sign number 4. Family members notice changes before you do. They say, "You've been repeating yourself. You already told me that. You seem distracted." Never ignore observations from people who know you well. The brain loves routine. Neuroscientists have discovered something fascinating. The aging brain thrives on consistency. Consistent sleep, consistent meals, consistent exercise, consistent social interaction, consistent learning. The healthier your daily routine, the more resilient your brain becomes. 5 habits that protect memory naturally. Habit 1. Walk every day. Movement increases blood flow to the brain. Even 20 minutes makes a difference. Walking is one of the most studied activities for healthy aging. Habit 2. Eat brain-friendly foods. Colourful vegetables, fish, beans, olive oil, nuts, whole grains, fresh fruit. A healthy brain begins with healthy nutrition. Habit 3. Challenge your mind. Read books. Learn a language. Play music. Solve puzzles. Write stories. Your brain grows stronger when you continue using it. Habit 4. Stay social. Conversation activates multiple parts of the brain simultaneously. Isolation does the opposite. Call a friend. Visit family. Join a walking group. Volunteer. Stay connected. Habit 5. Review your medications every year. This may be the easiest and most powerful habit of all. Bring every bottle, every prescription, every vitamin, every supplement, every over-the-counter medication. Ask your doctor or pharmacist, "Do I still need all of these?" That one question could protect your memory more than any supplement advertised on television. The doctor's checklist. Before starting any new medication, ask these 5 questions. Question 1. What problem is this medication treating? Question 2. Is this intended for short-term or long-term use? Question 3. Could this medication affect memory, balance, or concentration? Question 4. Are there safer alternatives for someone my age? Question 5. When should we review whether I still need it? These questions transform patients into partners, and better conversations often lead to better healthcare. An inspiring story. I once met a retired school principal named Robert. He was 82. Every morning, he walked to the local coffee shop carrying a notebook. People assumed he was writing memoirs. One day I asked him, "What are you writing?" He smiled. "Every day I learn one new thing and write it down." Sometimes it was a bird he had never noticed, sometimes a new recipe, sometimes a quote from a stranger. He told me, "The brain is like a garden. If you stop planting, nothing grows." That sentence has stayed with me ever since. Final message. Medications save lives. They reduce pain, prevent strokes, control blood pressure, treat depression, manage chronic illness. They are one of the greatest achievements of modern medicine. But every medication should have a purpose. Every medication should be reviewed, and every medication should continue earning its place in your daily routine. Never stop a prescription on your own. Never replace medical advice with internet videos. Instead, be curious. Ask questions. Stay informed. Partner with your healthcare team. Because protecting your memory isn't about avoiding medicine. It's about using the right medicine at the right dose for the right reason at the right time. And sometimes, the most powerful prescription isn't another pill. It's a daily walk, a healthy meal, a conversation with a friend, a good night's sleep, and the courage to ask, do I still need this medication? If this video helped you, share it with someone you love. One thoughtful medication review could change a person's future and help them stay mentally sharp for years to come. Stay healthy, stay curious,